this. So this is the state where I live. There's a lot of water, a lot of lakes, and a lot of snow. So it can be very cold during the winter. We have like 5 months of winter. Usually it's minus 20 Celsius during the winter. And the one advantage that we have is that it is very sunny. So it is not cloudy. And although it is cold, we have a lot of sunlight over here. Yeah, I want to just do a very brief introduction of my career for the ones that you have never seen one of my lectures. So I was raised and born in Peru in South America and practiced for 6 years as a GP, as a general dentist. Then I moved to Brazil. So I completed a master and a PhD in endodontics at the University of São Paulo in Brazil. Then I moved to the States where I completed my endodontic certificate at the Albert Einstein Medical Center in Philadelphia. So after so many years of research, I was just thinking about going to private practice or joining an endodontic practice or being an educator. So I chose the last option because of my background, but I still doing clinic. I'm treating patients 2 afternoons a week. So I have also some clinical experience. And I'm an associate editor of the IJ for the last 5 years. So working on disinfection, basically. And something important that I would like to mention is that I don't have any conflict of interest related to this presentation. So you will see some commercial products or some brands or some names. I don't have any commercial interest and don't receive any payment from anybody, basically. And I like this slide because we need to put everything on perspective. So this is data from the American Association of Endodontics. It has probably around 10 years. We have 22 millions of endodontic procedures every year in North America. And if you observe the data, at least 74% or 3/4 of these endodontic procedures are performed by general dentists, and only a few fraction, 25% or 1/4 of endodontic procedures are performed by the general dentist. However, it is expected that both treatments meets the standard of care. This means that the public and the society expect that the root canal treatment, it doesn't matter if it's performed by a general dentist or if it's performed by an endodontist. The standard of care of the quality of the treatment that is expected for the public, it is basically the same. And something that I would like to mention, because we are going to talk about disinfection, and probably you will see some slides talking about anatomy, is that the endodontic treatment has many variables. Although the disinfection and the finding of the root canals in a tooth is very important, we need to pay attention also, for example, the decay. How large or what is the extension of the structure that was lost by the caries? So it's not going to be the same prognosis if you have an occlusal access, or probably you have an MOD restoration where you have less tooth structure. So that may impact the restorative prognosis. So you have a delaceration, you can have some accidents like ledges or zippings,